Quite often we get into situations where we require to confirm the diagnosis before initiating the treatment in some patients, and these bedside tests are going to be of very much value in such situations. That's why we are going to cover all bedside tests in dermatology in this particular playlist, which is going to be covered in this particular bedside dermatology resident survival guide course on YouTube. So watch this introduction video to understand what is bedside test, what are all the tests which are going to be covered in this particular course, what are the pros and what are the cons, and some key takeaways related to the bedside testing in dermatology. Hello dear students, myself Dr. Maddineni Srinivas, welcome back to my YouTube channel. So if you are watching this video for the first time, do subscribe to this channel to get awesome content on dermatology subject on a regular basis. And please do hit that like button if you already like this concept of making a video related to bedside testing in dermatology. So without any further delay, we are going to begin the discussion by seeing what is the definition of this bedside testing. So by definition, remember dear students, it is basically the test which can be done at the point of care. What do you mean by point of care? At the exact time and place of the patient care. That is, it could be in the outpatient department and also in the inpatient department. Remember, it bridges the gap between the clinical examination and also the laboratory confirmation. Obviously, there are some tests which are going to be done on a lab basis, right? And also there are some tests which we can do just in the OPD also. So this bedside test, it is a bridge between this clinical examination part and also the laboratory examination part. So basically there should be some essential fundamental skills which should be there for all practicing dermatologists and also especially postgraduate students who are in the process of learning all the aspects, basic aspects of dermatology. So even with the advent of highly advanced technologies, remember the bedside testing is going to be very crucial for getting the rapport between yourself and the patient, and also obviously to get the professional diagnosis and also sometimes even to confirm the diagnosis before the initiation of the treatment. So what are all the types of the bedside tests? So there are clinical bedside tests which are going to basically help in arriving at the provisional diagnosis directly at the bedside, and this will facilitate the immediate early management, which could sometimes be difference between life and death of the patient, and it is crucial for rapid prevention of the disease complications. And there are certain investigational or laboratory based bedside tests. These are going to help in the final confirmation of the provisional diagnosis whatever we have made, and this will aid in the evidence based management, and it is going to help at the very earliest point of contact with the patient. Whenever we get the confirmation, we can treat the patient on evidence based management. So what is evolution? So if you look at, there was historically the usage of the medical laboratory which was having certain issues, like specimens had to be sent away from the point of care. Immediately the diagnosis or provisional diagnosis were not possible. There was a waiting period, turnaround time was very high, which we call it as TAT, turnaround time. Okay, that would also obviously delay the management of the patient. So now we have this contemporary practice of the bedside testing, where the diagnostics are performed immediately during the patient encounter, that is in the OPD or IPD. When properly implemented, these are going to be helping efficiently and also cheaply, and immediate diagnosis and treatment is going to be possible, and it is going to eliminate this dangerous waiting period which could delay the treatment management protocol. And what are constituting the bedside test? We have this clinical bedside test, all of which are arranged in alphabetical order. We are going to see them one by one in the course, or in the playlist of this YouTube. So do not worry. If you want, you can pause this video and you can just read out what are all these tests and what are all these signs. We are going to cover them. And also apart from this, we have certain intradermal tests which could be performed to diagnose certain conditions, and also we have this laboratory tests which are going to help in the confirmation of certain conditions, right? So now we are going to see what are the advantages of this bedside test. So the key advantages are, first one is clinical utility. So they act as direct extension of the clinical examination. So while you are taking the history and while you are just glancing the lesions which are present over the patient's body, you can perform these immediately as an extension of this clinical examination. They are very easy to perform, most of them are very easy to perform. There are some signs which you could do. For example, in the P versicolor, you can do the scratch test, right? So like that, for example, and they are not going to cost anything for the patient, and they will help in the diagnosis early on. They offer quick answers to diagnose wide variety of the benign, malignant and also infectious skin diseases. So they will help in the rapid management because you can at least have a provisional diagnosis at hand. Rapidly interpretable results can be acquired. Like for example, in urticaria, you can perform the dermographism and you can say that the disease process is very active, right? Like for example, and it will also lead to the better clinical and the economic outcomes compared to that. Is, if you ask for let us say some investigation, blood investigation for a patient, they may not be willing to get that done because they feel it is invasive, or they may feel that it is a little bit costly to get the test. But instead, if there is any simple bedside test which you can perform to get the professional diagnosis, they will, patient will feel happy and they will feel confident with the dermatologist whom they are being associated. And of course, reliability and autonomy. The techniques are reliable, specific and easily repeatable, not that you are doing the test and it is getting positive. Anyone who is there, they are going to do the test is going to get positive results. Each technique is easily performed, though it requires expertise. This is one small con, we can say. Some of these may require some expertise. We are going to discuss that in the next part. Patient-centric benefit. So conducted directly in and around the patient, enhancing the satisfaction and the good experience which the patient gets. In your private practice, the patient will feel very happy that you have actually not just interacted, you have got a chance to touch the patient, and the patient may feel more secure, more comfortable sometimes with the patient, with the doctor's touch. Sometimes, you know, patients also get cured by just the touch of the doctor. Okay, so that is also going to be helpful, and it eliminates the need for sample transportation and turnaround time. Like I have told you, TAT time, this will reduce, and also some procedural delays might also be reduced. This enables immediate management, of course, the counseling, and prevents any unnecessary treatment escalation. So these are all the pros, but there are some cons also. There are some disadvantages that are associated. So remember, despite the immense utility, point of care testing brings specific challenges. Like for example, it requires definitely expertise and training. You need to have this expertise. Try and you are going to achieve the perfection. But you should, while you are in post graduation especially, you should always, whenever you get a doubt in any disease, whatever bedside test can be done, try to do all of them, try to perform all of them, so that you are going to get a knack of utilization of the most reliable, most simple of this bedside test among the varied options. So obviously adequate training is very critical. Pre-analytical errors, see, when you get experience, then you are going to make less number of these errors. So get as much experience as possible during your post graduation itself. And obviously there is going to be a task overload, that is, you are just taking history and doing the examination, and you can send the investigations in the normal routine thing. But in this bedside testing, you need to do the extension part also, that is taking the samples, okay, doing some performing some sign. So these are some time taking process. Obviously, if your OPD is very busy, then it might be a little bit of hectic task on you. So that is one thing because of which inadvertent execution errors might creep in. So take care of this. And the environmental exposure, that is the portable nature of these tests, reagents and samples. There is a problem with contamination, or you might get exposed to certain serum or blood related products. So take universal protection whenever required, and always during any processes which require contact with the blood products. So like I have told, pre-analytical errors could be there because it requires, maybe some of them might require multiple stages. So specimen identification collection. So these are all some very important points. Always when you are sending the samples, make sure that you are going to send them very carefully. You are not going to cross either kamal udar kamal either, like that. Please don't cross over the patient sample IDs. So that is one thing which is very important. And also variable accuracy. Sometimes bedside tests may sometimes be less accurate than the traditional laboratory testing, right? This is attributed to personal training and lack of the strict control over the pre-analytical, analytical and the post-analytical variables. There are so many variables which could be messed up, because of which sometimes the investigation, the results may be wrong. So these things we have to take care. So we'll see what are all the problems in the specific chapter wise when we're discussing what are all the bedside tests. Okay, so to conclude, see, the bedside tests definitely are the essential clinical skill which every dermatologist must have, despite the limitations, and also despite the availability of various hi-fi technological tests which are there, right? They provide unique efficiency and operational autonomy. So that will help in getting the good rapport with the patient and other uses, like we have already discussed. Diagnostic power. Numerous bedside maneuvers help narrow down the complex differentials which you might be thinking in between the patient's skin issues. And see, remember, these clinical signs are not 100% sensitive. That is, sometimes they might not be useful in the screening. When present, they are highly specific and can clinch the specific diagnosis. Sometimes this is a case. Importantly, their use may even obviate the need for some invasive biopsy in some conditions, right? The educational gap, obviously, the many dermatologists rely on the knowledge acquired during the post graduation, which is often conveyed verbally by the senior trainers. This is a basic problem which many postgraduates face. See, so you need to have something in written format, and also this course I will try to include the PDFs of whatever we have discussed. I will try to provide these PDFs in this course. You can also see that in the description. Most likely the YouTube might accept this if we give this as a course. So you can check out the file. I will leave the link for the file in the description below. So there is a need for this literature. The lack of substantial standardized literature on the methods interpretation might prevent clinicians from performing them, forcing them to resort for the more expensive and elaborate laboratory testing, right? So these videos, this course is going to help you to get that literature in a proper order, so that you can read that, you can watch these videos, and you can actually perform these on the patients. So the takeaways are: the diagnostic utility of this point of care, clinical and laboratory evaluations, definitely invaluable for the accurate identification of the condition and also early management of the routine skin disorders. Like I have told you, the procedures results may yield interpretable results very fast, and also reproducible. So they will facilitate the prompt and effective therapeutic intervention, which at times may be saving the life of the patients also. And also versatility in the practice, they serve as an essential diagnostic resource for dermatologists, aiding in the successful navigation of both complex diagnostic dilemmas and also everyday clinical presentation. Essential clinical competence, definitely you need to have the experience, which is going to be acquired only through making some errors initially. So do that, get the experience and reduce the clinical errors. That is what is all of us are going to do throughout the life. All of us are going to be the lifelong learners. Okay, so there is nothing like newcomer and the person who is senior most. Everyone of us are learning dermatology on a regular basis throughout our lifetime. So do great, and this is the introduction video. I hope this was helpful. So that, if so, please hit the like button and also do comment anything specific which you want in dermatology. So thank you so much. Happy learning. We'll meet in the next video very soon. Sarvam Sri Krishna Param Sarvechana Sukhana Bhavantu. Bye bye.